Well, bedwetting is a very common issue, and in fact, it's estimated that as many as 20% of otherwise normal children who are starting grade school will be wetting the bed. It also tends to run in families, and if a mother or father tended to wet the bed, say, till age 10 or so, if a child has bedwetting also, it's a good chance that they'll wet the bed for a similar length of time. Many children who have bedwetting also have daytime bladder control issues. So the first thing that we assess is for whether the problem is in fact limited just to bedtime or is also a problem in the day, because it influences how we approach it. But as far as other tests or things, if the child is otherwise normal and only has bedwetting, it's not an issue that we need to do x-ray tests or other evaluations. It's more of a matter of just finding therapies to help relieve the problem. There are various theories as to why some children wet the bed. There may be a lack of a hormone that controls how much urine the kidneys make during the night, so that they make too much. And yet, even in that case, one has to wonder why they don't just wake up and go to the bathroom as an adult would. So there may be also issues with arousal mechanisms and the brain monitoring the bladder during the night. It's not completely clear why children wet the bed. Many parents wonder if the child is having problems with day or nighttime accidents related to just playing too hard or not being attentive or acting out, or various issues like that. And the fact is that most of the time children who are having wetting have some underlying issue with that. They're not wetting intentionally. There are basically two broad categories of treatment. One is treatment to speed up the bedwetting going away, and the other is to control the bedwetting until it goes away on its own. And so in the first category, to make it go away faster, is alarm conditioning, where small sensors are placed in the underwear. The child begins to wet at night, a little alarm goes off, mom has to wake the child up at the time the wetting is occurring. And by doing this over a period of a few months, as many as half the children will have the bedwetting go away. Conversely, if that doesn't work, or if it's just not going to be practical for the family to do it, we can use medication therapy, and there's various pills that can be taken at bedtime to control it. The issue with that is the pills may work, but if you quit taking the medication before you've outgrown the bedwetting, then you'll continue to have the problem. So I treat for 6-month intervals until we see that the bedwetting has gone away.